Wonderful. Well, good morning, and thank you everyone for joining us. We know your time is valuable, and we are grateful you chose to spend an hour with us to explore one of the most exciting and fast-moving areas in the benefit space and life in general, artificial intelligence, and how it is changing the way employers manage cost, complexity, and the employee experience. Today, we're going to unpack what AI actually means for employee benefits, what is real, what's possible right now, and why HR and finance leaders are in the best position to drive impact for your organization. Some housekeeping items up front. We are recording this presentation and we'll share a copy with everyone following the meeting. Please feel free to ask questions via the Q&A chat function, which is in the bottom right, and we'll do our best to answer them in the moment or we've allotted time at the end to make sure we don't miss anything. To help set the stage, I just want to remind everyone, technology is simply a better way of doing something. AI is not here to replace you as a human, not yet anyways, but it is a tool, and it's a tool that's evolving faster than anything we've ever seen. So today's hosts, I'm Nick Belanca, an employee benefits consultant with Lockton. With me today are Sarah Shaw, also with Lockton, and Max Birnbaum with Avante. As it relates to today's agenda, our plan for this webinar is simple. I'll share a brief overview on the current state of employee benefits. Sarah will share a point of view on how data can and should drive strategy and impact. And Max, the star of our show, will provide a live demo that will allow you to see firsthand how AI can help you reshape the employee experience and convert your data into usable information. And as mentioned, we'll leave time for Q&A, but feel free again to ask questions as we go through the presentation. Most importantly, we're going to show you how AI can help you scale benefits personalization and execute and manage your benefits program like never before. So the state of employee benefits, let's talk about this. If you want to move to the next slide, Max. Sadly, we all know this, but it continues to be the headline. Costs are rising and employers have hit a breaking point. For the first time in 6 years, reducing costs is the #1 factor in benefits decision-making, overtaking attract and retain. Not only is it the #1 factor in decision-making, employers overwhelmingly say increasing costs is the biggest challenge in managing benefits. So the question for many of us as we head into 2026 is not how much benefits cost, but what strategic value are we actually unlocking from them? So let's transition to the root causes. Why are healthcare costs so high and why is this going to continue? The challenge right now is there are so many factors driving costs up. It's a storm of chronic ongoing conditions, GLP-1s, brand and specialty medication costs increasing, high cost claims, the size, frequency, and severity of large claimants continues to grow. And then you added market pressure such as inflation, tariffs, and provider contract negotiations. And it is a swarm of different headwinds that are obviously leading to the continued cost pressures that we're seeing and that we'll continue to see over the next couple of years. If you want to move to the next slide, Max, you can see here the 2026-2027 expected trend line by coverage. And here's something most people don't realize, and it wasn't mentioned on the prior slide, but it provides some foreshadowing for later in our discussion. AI is already being used to increase your costs, our healthcare costs. Hospitals and healthcare systems are investing heavily in AI to improve revenue cycle management, meaning more complex coding and higher reimbursements, more revenue capture, as they like to say. So employers need AI tools or you're fighting this problem with one hand tied behind your back. You must use AI to fight AI. So let's move to the next slide, Max, where I want to share some of the recent headlines and the benefits news over the past 30 days. I kind of laughed when I saw this one, data-driven benefits gain ground. Well, I hope so. But this is the exciting part and how we battle against all of those headwinds that I just mentioned. AI finally allows us to do what HR and benefits teams have always wanted to do, combine first-party data with third-party data, personalize benefits at scale, and transform disparate data sets into simple, actionable stories. Hopefully all of you on this call would consider yourself data-driven leaders, but we can now take the next step as it relates to connecting the dots in ways that were never possible until now. So some open enrollment headlines, understanding versus satisfaction. According to a recent study, employees actually understand benefits more than ever. Over 80% responded saying they feel well informed. But sadly, satisfaction has dropped significantly with that understanding. Only 60% are satisfied with benefits because understanding is not enough if the experience feels complicated, expensive, or impersonal. Additionally, 62% of millennials use ChatGPT to review their benefits most recent open enrollment, which is probably not a surprise, but it is very concerning. No HIPAA or PHI protection in place, obviously, which puts companies at risk. ChatGPT is not an expert on your company's benefits, nor are they an expert on your complex benefits ecosystem. This does confirm something we probably already know. Employees are already looking for personalized guidance. We, as employers, just haven't given it to them in the way they want it, and they will look elsewhere until they do. So before I hand it over to Sarah, I want to leave you with this framing. AI is the worst it will ever be today, and it is still magic. It only gets better from here. And there was a great sentiment shared from the benefits director of Zscaler, who implemented Avante's AI benefits platform this year. She said the question is no longer, and for them was no longer, should we? It was, how do we do this well? How do we do this safely? And how do we measure it? Also, I love biographies and history, and recently came across this Andrew Carnegie quote from the late 1800s that still holds very true today, especially as I think about AI. Invest in technology because the savings compound, and it gives you an advantage over slower moving competitors. That can be the difference between profit and loss. Simply put, each of us has an opportunity, a huge opportunity to create a competitive advantage for our organizations if you're able to leverage this technology more effectively. With that, I will hand it over to Sarah Shaw, Lockton's Director of Population Health Strategies, to discuss leveraging data for strategy and impact.
Thanks, Nick, and thank you again for inviting me to be a part of today's conversation. So appreciate the introduction. As the Director of Population Health Strategies here at Lockton, my role has many different components. One of the key roles and why I'm a part of today's conversation is to talk about how we are using data to help support our clients, working collaboratively with the core teams that support on all of your traditional lines of coverage, thinking medical, pharmacy, so on and so forth. How do we do all of that and pull all of that together to lead with data to identify where are those actionable opportunities? I'm not going to read this slide to you. The part that I want to make sure to really draw your eye to is there at the bottom in bold, right? It's the insights that lead to action. One of my favorite quotes that we're also going to close my portion with is data is just data. It's what we do with it that matters. And that's truly the guiding principle that we use as a team to make sure that we're leading with data to identify opportunities to impact your strategy. Max, if we want to go ahead and go on, perfect, you were reading my mind. Thinking about one of the tools in our toolbox. So we all know there are many, many data resources out there, and thinking about how we access that data, make it meaningful, make it impactful is one of the key pieces when we think about guiding that strategy with data. So at Lockton, our proprietary data analytics platform is called InfoLock. Of course, I'm biased. I think it's better than everything else out there. But as we will talk through, there's opportunities always to collaborate and work with different partners to enhance the content that's available. As we think about digging into data, we like to think of a single source of truth, a single source to identify what's happening on the medical side, the pharmacy side. If you currently have maybe those carved out, so you have a separate carrier or TPA from your PBM, getting that aggregate data can be very difficult with those separate partners. So leveraging one platform to really dive into that combined collective portion of the data to truly understand the risk. For many organizations, it's also thinking about what's happening on the leave side of the conversation, disability, work comp, and how do we think about all of that more holistically, not to just focus on the health plan side or the work comp side, but really think of the population as a whole. So lots of words, lots of fun icons on this slide, but as you start thinking about, again, leading with data, leading the strategy with data, It's about identifying those key actionable opportunities, pulling out where we can impact the management of chronic conditions, how people are using the plan to better care for themselves. Are they going to the most appropriate, highest quality, lowest cost providers, et cetera? One thing I want to hit on, and I think Max will talk about this a little bit as well, is that we can't look at any of this in a silo or in a vacuum. And so as we think about pulling not only the data together, it's also about pulling together the experts to understand from that true clinical standpoint, doctors, nurses, pharmacists, what is meaningful in the data. The people who look at the data on an aggregate level from a population standpoint, how do we continue to fine tune what makes sense for you as an employer to invest in based on your goals as an organization, your risk tolerance, et cetera? How do we look at all those key pieces together? And then tying that to the bigger picture with your a core account team with you all to make sure that we're not looking at just the benefits as one piece, but that overall total rewards package to impact risk. So I've talked about the data, and it, as I mentioned, it's what we do with the data that truly matters. The last piece I want to touch on here is just the people side of it. And Nick touched on this already a little bit. I know that this will come up with Max's portion of the conversation as well. We have amazing technology today. We have a lot of opportunity to continue to enhance, and what Avante is doing is amazing in that space. We can't lose sight of the people part of it too, and having the experience from the people, the expertise that the people bring to the table to really leverage and use that data in the best way. The one piece I want to touch on really quick before I pass the mic is also that impact, right? So I talked a lot there about how we use data up front, but we also have to make sure we're measuring the impact of any strategy, any solution over time. So having the right tools, the right resources to go back and look at whether it's a solution we deployed or a change in plan design, always monitoring the impact of that change or that addition to make sure it's meeting the outcomes, that we're getting to those desired goals in the long run. I said one more thing, Max, I'm going to add one more comment, and then I promise I'll pass it to you. I want to make sure we have plenty of time for your portion. The last piece I want to just touch on is data also helps influence our market, right? So when we think about all of the vendor partners, all of the solutions that are out there, using all of this data to help both lead on identifying those best in class solutions, right? How do we vet and make sure that those solutions are promising or delivering on what they promise, but also potentially influencing the market? With all of this data that we have at our fingertips that Avante is using, right? We can identify there are some gaps still in all of the solutions that are out there. How do we use that data to help influence and make sure we have the right partners to support the health risk of the population? I think that was slightly more than 5 minutes, but Nick, I'm going to pass it back to you to keep us moving.
Thank you, Sarah. So we will transition the mic over to Max with Avante. And we have vetted several solutions in the market and will continue to do so, but we have been extremely impressed with Avante, and the support and the reviews from the clients has been fantastic on their platform and the impact to the businesses who have rolled it out. So with that, Max, take it away.
Excellent. And Nick, Sarah, and to the Locked-In team, just wanted to say thank you for all of your efforts in putting around the event today, and to all the attendees. We know December is a busy time post open enrollment and wrapping up year-end deliverables, so appreciate your time and attention today as well. Just quickly on the background side, I'm Max Berenbaum, lead the go-to-market team here on the East Coast at Avante. 10 plus years in the industry, started out on the carrier side, had jumped over to do benefits consulting, and most recently was also at Spring Health. As I had this journey throughout healthcare, there was always this missing piece of the puzzle of how do we, and where is a platform or solution that is finally prioritizing the entire organization, thinking about the employer side, HR leaders and their team, and also employees. And so that's really what brought me to Avante. And so at the highest level, a little bit of just kind of company background and origin story, if you will. We'll jump into the AI agents that we've deployed today, show you a quick demo of both, and then talk about the value and the ROI, right, that the clients and our partners are seeing, and really highlighting the overall solution. And so with a little bit of that origin story, Avante's been around for about 2 years. We're headquartered out in Seattle. And really what we started with was building our own proprietary programming and coding that is patent pending, thinking about how can we create the first of its kind AI benefits and total reward platform. As we've thought about, of course, security and compliance is a foundational building block, of course, SOC 2 and HIPAA approved. As we think about where we're providing support, we are supporting our clients today from a US perspective. We just got our GDPR approval, really excited to go global starting in Q1 of 2026. And again, as you can see, some of our strategic partners and our customers here, I think our focus has been how can we be that strategic partner, again, to the entire organization, thinking about how can we support you all as HR leaders that are on the call today, and also your employees. The way we've been able to do that is deploying two main AI agents that you can see here. And so just to quickly introduce both before we jump into some demos, Carly on the left is our employee-facing AI agent. The way to think about Carly is really she can handle and support any employee inquiry or question, but most importantly, throughout the entire annual life cycle of an employee. So if you think about as a new hire, onboarding, understanding what they need to achieve in the first 90 days, of course, supporting open enrollment and decision support, providing really best-in-class, detailed and personalization support throughout that process, ensuring that they're selecting and choosing the right and the best plan for both them and their families, aligning to their healthcare goals and needs. Outside of that, we're then there to support the employee as they select that plan so they can understand and finally engage and utilize in those benefit ecosystems that you all are heavily investing in, right? So if an employee has a question about parental leave, wants to understand the time and the benefit of the leave, how much they'll get paid, the process and the paperwork that's included, Carly's there to support them. If they have a question around mental health support and you've invested in an EAP, right? Or maybe have some back pain and are looking at an MSK solution, thinking about how can they manage a chronic disease and management such as diabetes, we're here and Carly really acts as a flashlight or almost a microphone to help the employee again learn about that benefit ecosystem and drive positive steerage to those programs that are going to best support their needs. And from a total rewards perspective, if they have questions around retirement, things as 401k, Carly can help support on that side as well. I think a couple quick facts and important parts of Carly is we have not had a day yet that Carly's been sick or taken PTO. So she's 24/7. And so as you think about organizations that have shift workers, professional services that are supporting clients, traveling, longer work days, Carly's always there, even if the HR team is not available or online. Carly's also 50 plus languages out of the box. And so the positive feedback that we've gotten from our customers today is very easily and flexibly can support a diverse employee population. As we quickly shift over to Ava, the HR and consultant facing AI agent, the best way to think about Ava is an AI forward, nimble data warehouse. And so Ava is powered by three main pillars of information and data. And so first and foremost, all carrier data. So if you think about medical, RX, dental, vision, claims, cost, and utilization. Secondly, Ava is also powered by and has all data around point solution and vendor performance. So again, budgets, costs, trends, utilization, and engagement, but finally all underneath the same hood and in the same database as that carrier data, breaking down those silos that exist today. And then finally, the last pillar of Ava is Ava and Carly actually talk to each other in the back room. And so Ava can provide aggregate reporting on conversations within Carly, right? So now think about supplementing or even removing the need for a post-open enrollment survey, because now you and your HR team can have a pulse on what's working, where are pain points that employees are dealing with throughout that open enrollment process, not after, in real time, giving you the opportunity to adjust and ensure that you're meeting your employees' needs when it's one of the most important times of the year. Outside of that, of course, you'll always have an updated view on what are the most common questions, topics. We're even able to capture the tone and sentiment of the questions if there's a positive or a negative or confused tone. Again, supplementing that need for an open enrollment or even annual benefit survey, always giving you that pulse on your organization. Wanted to just quickly highlight how we power up and customize and personalize Carly, our employee-facing AI agent, and then we'll jump into the demos. And so as you can see here on the left side of our screen, what we create for each client is what we like to call a vault, and really a fancy way of saying a funnel that all of your company specific documents, plan designs, and data will be ingested and digested into our solution and platform. And so as you think about examples, right, we will train Carly and digest things around SBCs, SPDs, open enrollment guides, one pagers around those point solutions, vendors, and programs that you're heavily investing in and aligning your strategy to. Again, such as an EAP mental health solution, MSK, telemedicine as examples. Outside of that, FAQs around leave of absence, different leaves, parental, and then again, education and documents around 401k and other important benefits of part of your benefit ecosystem. As we think about now bringing Carly to life, I think one of the most important things is where Carly can live and support your employees throughout your benefit ecosystem. As we developed and launched Avante, and Carly specifically, our goal was not to make it feel like a very far away third-party vendor or app, but instead truly an operational layer within your benefit ecosystem. And so as we've really achieved Carly living and breathing anywhere where there's already established lines of communication or employee foot traffic, that has resulted in best in market engagement and utilization. And so about 30% of employees of our clients today are having questions within Carly and conversations as well. And so within the benefit ecosystem, just a couple examples, we can actually sit inside the HR or the benefit support inbox. And so as employees are sending questions, inquiries to your team, Carly, right, joins your team and will actually draft a response within seconds, saving your HR team hours within each week, and then driving accuracy and consistency in the responses as Carly is leveraging your plan documents and benefit ecosystem details to drive awareness and answer the questions from the employees. From there, employees can also access Carly within HRIS and benefit admin platforms and solutions, thinking about ServiceNow, Workday, Oracle HCM, Dayforce, Benefit Focus as some examples. We have a web-based application that I'll be showing you today. Most importantly, also mobile friendly, so very easy for an employee again to get engaged. And we even show up in Slack or Teams, right? So we can really, again, be extremely accessible to employees just as they're reaching out and communicating with a coworker. They can Slack Carly a question around their benefits, what's covered versus what's not, how much should they be prepared to pay if they're going to an urgent care versus ER. And Nick and Sarah, I just wanted to get a check. Are any questions in the chat as I jump over to show Carly and Ava?
Not yet.
Excellent. And so again, we're in our web-based version of Carly. These tiles down here will be personalized to an organization. And so as you think about getting ready for Mental Health Awareness Month, if you've just launched any new solution for, 1/1, again, that's where Carly can be that microphone or the flashlight. As we said before, Carly's also 50 plus languages live. And as you can just see, very easy to transition to any language that is going to be most comfortable and convenient for your employees. We hear feedback today that employees have a bilingual family and easily can address and support all of their questions switching between languages, even throughout one threading conversation. So some examples I just wanted to share to really illustrate the detail and the personalization of the Carly support. First and foremost, addressing one of the age-old conversations that almost all employees are having at the dinner table at 7 p.m. on a Tuesday. And that question is, hey, should I stay with my company sponsored plan, or is it time and will it support us better financially and align to our healthcare goals if we switch to our spouses? And so what Carly can actually do, you can easily upload a screenshot, a PDF, or an image of a spouse's plan and compare that to a company sponsored. And so in this example, comparing a high deductible to a type of POS plan, Carly within seconds gives a high level comparison of the two plans, and then most importantly highlights the differences in the plan design and that financial impact. From there, we then take this educational opportunity a step further and say, as an employee who might not be a benefit expert, of course, we highlight really important considerations and factors that they should bake into their decision-making process. And so as an example, when you're thinking about a high deductible versus not, it's really important for an employee to understand, what does an out-of-pocket maximum mean? What types of expenses count towards a deductible? Our goal is to create this path and bring the employee along a journey where they're getting this foundational and baseline education and knowledge so they can choose the correct plan that, again, will best align to them and their family's needs. As we think about this detail, I think a lot of the positive feedback that we've also gotten is the personalization and the ease of support that Carly can take plain language questions or even statements from employees and help them answer questions that they didn't even know how to ask. And so as an example here, right, an employee during open enrollment can say, hey, Carly, I need help picking a medical plan. I want to highlight I have 2 kids and one's struggling with anxiety. What Carly will do, will lead with some guidance and education and saying, hey, based on what I'm understanding, based on some of the priorities that you've called out, here are some of the best plans for you. Carly's also powered by the HRIS file and has the opportunity to be powered by the eligibility file as well. And so with that, Carly will know actually where the employee lives from a zip code perspective, making sure that Carly is bringing up and discussing plans that are relevant and available to the employee, along with programs and point solutions if there are any regional or office specific benefits. And so in this example here in the demo environment, we're closer to headquarters out in Seattle. And so Carly brings up the Kaiser plan as a great option for me based on some of the priorities that I've mentioned here. As Carly then dives into some of the best plans available based on those needs, Carly highlights those plan designs, right? The financial impact again, but takes it a step further and actually calls out exactly how much a mental health visit will cost just because the employee asked about that and made it a priority. From there, based on all conversations, we'll actually leverage our AI to generate the next best question an employee should be thinking about or asking. And so as you can see here, right, an employee might not even be fully aware or considering what will be the annual budget or spend if their child does need mental health support. What providers are within their network, and how does that plan and how do some of these visits compare from a financial perspective based on what plan they're thinking about enrolling in. From here, as we think about outside of open enrollment, some examples, you can even upload an EOB and Carly will be, that employee's assistant, helping them understand and break down all of the different costs and figures on that page, even highlighting what the plan's paid, what is responsible for the employee, and even gut checking if that total amount aligns to the coinsurance based on their specific plan. From there, we can also support, again, really that whole breadth and scope of total rewards. And so someone can ask about 401k, right? So think about a new hire. If you've just gone through large organic or inorganic growth, and employees are dealing with switching medical plans and then also migrating 401k platforms, Carly's there to support, right? And so Carly can quickly let an employee know exactly what the 401k platform is for their specific organization, the company match, the vesting period. What's most important about Carly's responses is they're all grounded in source and truth. And so as Carly's providing these quick and direct responses, we always let the employee know where they're coming from and even take it a step further. They're one click away from actually getting brought to that exact part of a benefit guide, a 30-page SPD or SBC, to understand more detail, right? And so in the 401k example, thinking about how important it is to select a beneficiary, truly understanding what the vesting period looks like, and all other details around the plan design. We know every employee doesn't always have time or reads page 30. And so again, that's where Carly can help drive them to that important detail around some of the benefits that they're interested in learning more about and engaging in. Nick and Sarah, I just wanted to pause to see, as we think about jumping over to Eva, if there's any questions or comments around Carly.
No questions, but I'll share some of the commentary that I'd heard from Sarah from Samsung, who was on your webinar last week, specific to Carly. What she said was that Carly, for their organization, was a game changer. It allowed their team to focus on strategy and true employee needs, and their big focus, and I'm sure many of the total rewards leaders on this call, their focus is helping their team members access the benefits they need at the time they need them and effectively navigate and utilize them. And that's where Sarah from Samsung felt Carly had a huge impact, was connecting those dots for people at their time of need, because we all know benefits are so confusing. And when you're going through a very difficult, challenging time in your life, you don't remember the exact benefits that you need that are being made available. And that's where Carly can step in and really play a significant role in helping people get access to the right benefits at the right time.
Thank you for that, Nick, and well said. And we have been really impressed and just proud, right, of the value that we've been able to provide for Sarah and her team at the HR side of Samsung, and then also their employee population. We were just at some of their open enrollment fairs, and it was awesome to kind of hear live from employees. And I think, one of those common questions and feedback that we got was, Carly helped me answer something that I didn't even know how to ask or think about asking during open enrollment. And so as we now transition to Ava, again, backed and powered by all of your benefit ecosystem data and claims, want to make this clear, this will just be available to the HR team, and then as the organization, if you'd like, also to your consultants, to kind of keep them in the loop and think about supporting the strategic partner that you have with them. And so I think, again, a couple examples to illustrate the value of Ava. You can ask questions, really from the bare minimum of understanding specific cost around a specific condition, type of facility spend, all the way to strategic conversations, right? And so an example on a little bit of that, higher end is if you have new leadership turnover, you just want to get a little bit of an annual report and understand how is your entire plan performing. You can ask Carly that, right? And Carly's going to provide an executive summary, highlighting key findings, outlining shifts in membership, right, from one plan to another, or a different tier of EE only, a large shift to EE plus spouse or family. Highlighting high cost claimants, trends in utilizations and shifts year over year there. What are the main drivers? Of course, highlighting and illustrating vendor performance. What's working well and where are there gaps, right, with some of your partners and point solutions. Providing recommendations, really getting into the detail around quarterly spend, breaking it down between medical and RX, highlighting it on a PMPM level. And then again, when we think about utilization trends, thinking about specific conditions, whether it's oncology, comorbidities, behavioral health, or MSK. And then also thinking about facilities, right? So as we think about ER, avoidable ER visits, inpatient versus outpatient, or in-network versus out of network. From there, if you're looking for more specifics, Ava's there to help, right? And so as you think about turning the calendar year and starting off 2026 and already planning for 2027 with annual strategy meetings, some of the most important things is to understand current state, right? And so you can quickly ask Ava, please let me know, top 10 cost drivers for my medical spend for the last 2 years, right? And within seconds, you can easily get that top 10 and start to understand trends year over year. Are there specific conditions, cost drivers that you really need to be prioritizing as you get into strategy mode, understanding and starting to evaluate important investments that need to be made, changes or RFPs, or adjustments within plan designs? And then from there, right, it's also always supporting any fire drills or last minute questions, right? And so a hot topic like GLP-1s, if C-suite, anyone part of the organization is ever curious around how is a specific condition or budget going, spend versus actuals versus budget, you can quickly ask Ava, right? And so just plain language saying, hey, listen, I need a GLP-1 overview. Please highlight key trends and cost. And what are some of those actual trends and utilization metrics, right? Because I'll steal Sarah's line that data is just data. And I think what's important is Ava helps tell the story around it. So it provides that executive summary, highlights those trends within utilization, highlights key observations within cost and overall metrics within members, copay, and overall spend. And so with that, I'll jump back to the presentation. And I think just to highlight a little bit about some of that value and the ROI that we're seeing today, as we've, of course, just coming off the heels of open enrollment, really excited about the results that we're seeing, and Samsung and Zscaler were talking about it last week. And so I think, first and foremost, we talked about it, about 30% of our customers' employees are having conversations before, during, and after open enrollment. During open enrollment, we see these employees being repeat customers, finally getting a true understanding of those benefit ecosystems that you all have spent time, effort, and dollars investing in. Now the employees can be aware of it and start to participate and engage in it and achieve some of that ROI related to those organizations, programs, and point solutions. I think one thing that I'd like to highlight is really just that about 10% of the questions and the conversations that employees were having during open enrollment actually helped them understand and learn about a new benefit that your organizations are already investing in and launched that they weren't aware of or knew how to sign up and engage with. From there, I think another important thing to highlight is really, again, that round the clock support, right? And especially during open enrollment, a busy time, over 40% of the questions from employees came in were actually able to be resolved outside of open enrollment. And so I think what we're hearing from our clients today is it's a thank you from the employee side that they're now getting that white glove real-time support. And it's also a thank you from the HR team. Right now during open enrollment, one of those busiest times, it's almost quiet, right? And you'll see that volume and inquiry of questions start to decrease as Carly is really being able to support a vast majority, over 70 to 80% of those questions coming in from the employees in your organization. As we think about all of this data that's even occurring and happening within Carly and Ava, a really important thing, again, is tapping into and understanding the trends and the utilization within the Avante solution and platform. And so an example here, there's really two ways that you can get this detail around all conversations within Carly. So first and foremost, as we mentioned, within Ava, you can real time, any day, ask questions around a specific week. You can ask Ava, please give me a high-level overview of Carly conversations and different questions and topics just during open enrollment. Outside of that, we'll also provide you from our customer success team proactive weekly reporting, right? And so once a week, you'll get this updated and status report. There was 300 questions asked last week. 29% were around leave, X% were around 401k. And again, we're even able to, thanks to our AI, capture the tone and sentiment. And so we will raise any flags or adjustments within that data. And so, for example, as you can see here, we'll give you benchmarks within, the Carly conversations and topics. So if usually about 78% of your negative conversations are around 401k and that ever jumps up, we'll let you know, right? And then as you can think about working with, Nick, a strategic consultant, do we need to do a 401k webinar? Do we need to think about building better employee communications to let them know about how to sign up for 401k, what the vesting period looks like, to really help meet those needs and pain points that you're now learning and observing in real time, thanks to Ava and the reporting. As we think about some of the ROI, right, I think we've highlighted that really supporting just the email traffic, we've been able to give hours back to organizations, thinking about, organizations and companies we've been supporting from 100 employees all the way up to 30,000 plus. I think a quick point there with Carly, we really see an ideal customer being any organization, starting with that 50 to 100 life group, again, all the way up to kind of those larger enterprise organizations. We've seen success, value, and ROI almost immediately with any type of organization within any vertical or industry. As we think about Ava, of course, looking to partner with a self-insured organization so we can get all that claim level detail and really have that opportunity to, again, connect all of those siloed data and data sets today so you can start to have an understanding what is the costs and the trends within the carriers, the point solutions, and in understanding the employee sentiment and needs based on the benefit ecosystem that you've built and what's working and what's not. And so as we think about that ROI, I think just quickly to give some remarks around the true hard savings that we've been able to drive with our customers today, it's thinking about as your organizations are, of course, getting ready to grow and evolve, you can now do that without scaling the HR team, right? Getting Carly and Ava, if you will, as a member of your team will give you that opportunity to not only scale not only support a scaling organization without growing your HR team, but even giving your team time back today so they can be more strategic and think about supporting other initiatives, how to grow retention, how to think about talent reward and other top priorities that you have within your HR team. We've been able to sunset legacy decision support tools, again, driving an immediate and hard ROI. And then think about streamlining budgets around data warehousing and communication budgets. Again, as Carly is really acting as that AI forward, best in market member experience, supporting microphone to your employees and really assisting them support throughout going through that journey within your benefit ecosystem, ensuring that they're engaging and utilizing it. That was everything that I wanted to wrap up and talk through today. I'm sure as we're talking about this value and ROI, you're thinking about pricing. We would love to have a follow-up conversation at the highest level. We do annual pricing based on the employee count of your organization. We've enjoyed as Avante partnering with Nick and his locked-in team so much that we've actually just created preferred pricing as part of our partnership and support together. And so again, would love to follow up with anyone who's interested in learning more about Avante, doing more of a deep dive into our solution, and happy to talk through some of that preferred pricing as well. Nick and Sarah, that was everything on my side. Again, thank you for the time. I know we have some time now, and so really eager to hear from the group. Any questions around some of the materials that Nick and Sarah walked through, or the Avante solution and platform as well.
Yeah, so don't be shy. Feel free to again click in the bottom right and ask any questions you may have. But I have a couple, Max, that I'll tee up. Where are you seeing your clients start? Carly, Ava, both. What's the experience been there?
Yeah, and so it's an important and great question, Nick, because as AI is still fairly new, especially to the HR world, I think it's important to start a journey that makes sense and is comfortable in earning trust in a partnership with an organization. And so I think at Avante, we really like to, kind of think about it in those stages of a crawl, walk, run approach, right? And so I think what we've done with the majority of our organizations that we're partnering with today is starting with Carly, the employee-facing AI agent. As we think about an implementation process, we can actually stand up Carly within less than 30 business days. Again, leveraging our AI to train the model specifically on the organization's materials and benefit ecosystem. And then as we get that quick win, support the employees, earn their trust, then think about getting into that stage of really having Avante be that operational layer into the benefit organization and thinking about then turning on Ava, the data warehouse capabilities to give, again, that two-pillar support for the HR team and their employees as well.
And I'm sure somebody's thinking about this is, obviously with AI hallucinations and errors, obviously that occur. We all heard those stories and why certain organizations no longer utilize ChatGPT or they have very strict parameters around it if they do allow it. How are you addressing, I would say, errors that do come up? And then how are you helping organizations where maybe the HR and benefits team is really interested, but they need to get buy-in, probably from finance and likely IT as it relates to making sure it passes their AI readiness requirements?
Yeah, great question, Nick. And so I think, first and foremost, we are a closed loop learning model. And so with that, Carly can only leverage the organization's specific details, documents, and plan designs, and then really a benefit expert knowledge base that we've built internally, right? And so with limiting and Carly not being able to access the web, any misinformation or information out there, it really has reduced and almost eliminated Carly's opportunity to hallucinate. So we have over a 99% rating on accuracy and groundedness, again, as Carly is leveraging the company and employer data. What I will share is during implementation, almost another value that the employer will get is really Carly's implementation acting as a free auditing tool, right? And so I think we've been met with some skepticism, right? As AI is so new and HR leaders are curious, is Carly getting this right, wrong? And so I'll share just a quick soundbite from the other day as we were getting ready to go live with an organization. The HR team had just adjusted plan design for Skyrisy, right? Shifting from co-insurance to a copay. And they were asking Carly during our training and testing, and Carly had said that it was still co-insurance. And, of course, a little bit frustrated. What we actually helped them identify was 3 days before they were launching their benefit guide to their 4,000 life group, there was an error. And their benefit guide had not been updated based on all of their plan design changes. And so again, right, I think I share that just to say, one, how much Carly can really help to ensure that all of the different documents within a benefit ecosystem, as we think about SPDs, SBCs, and then, homegrown, if you will, benefit guides and overviews are all aligned and speaking that same language. And then again, that's the only source that Carly's leveraging, ensuring those accuracy and then company specific responses from Carly.
That's great. And then how are you helping HR teams get Avante approved or reviewed by their IT team, CISO, whoever is responsible for evaluating any AI related implementations?
Yep. Yeah. And sorry, I forgot the second part of that question there. So thank you for that. And so listen, right, we know AI is new. And I think most importantly, we're excited to be a strategic partner, even throughout the evaluation process before implementation and launch. And so as we think about really helping support and educate the HR team on how best can we help arm them and really walk through the process and journey with them as we think about AI, IT, and compliance questionnaires, committees. We're very proud, again, of our foundational pillar and really block being security compliance, thinking about SOC 2, HIPAA, and PHI. And so I think, we're ready for it. And we've been really proud of the results that we've seen with the organizations and the clients that we, support today. Zscaler, I think a great example, publicly traded organization, of course, focused on security and cybersecurity specifically. We've passed all of their AI, IT, and compliance test questions and committees with flying colors, as it's been a top priority for us since day one.
That's great. Max, I'm curious, any other, I don't know if it'd be surprises or interesting discoveries as you went through open enrollment and hearing from clients that have rolled out either Carly or Ava? I mean, obviously you mentioned it almost being like an audit tool, right? That was probably a bit of a, unintended benefit of Carly, but have you seen any other kind of surprises that have come through the rollouts and implementations over the past few months?
Yeah, sure. Yeah, I will say that, the audit functionality, we definitely got that feedback from our clients. And so unintended, but it's been impressive to see how much value even just that has really shown throughout that implementation process. I think from there, it's not even just a surprise from us, and it really wasn't, but I think sometimes it's just great to see the shock from the HR teams that we're working with on how much of the traffic has been outside of working hours. Right. And so again, we're seeing over 42% of the questions coming in during open enrollment outside of those working hours, weekday nights or the weekends. And employees are always thinking about benefits, right? And especially during the day when they're focused on their job functionality and those daily deliverables, they don't always have time, right, to think about, should I go with the high deductible plan or the PPO? If I'm looking to work on or improve my mental health, right, what is the EAP, or right, what does an EAP stand for? What does my company offer for mental health support? But when it's a Sunday night, when they're talking with their family or their spouse on that Wednesday or Thursday evening, that's when those real life questions, conversations are happening. And then most importantly, that's when Carly's also still online, right? And so able to support them. And so I think that's been some of the feedback. I think we were excited to see the kind of during the day and outside traffic. But the HR teams really, I think the light bulb went off and saying, wow, employees are thinking about and wanting that round the clock support.
And then from an industry perspective, are you seeing different levels of engagement depending upon the demographics within an organization?
Yeah, great question. So I think a really important thing about Carly is how personalized we can make her responses, and even the view of Carly, right? And so first and foremost, Carly can be completely white labeled. And so we've had Carly all color schemes match the organization's colors and branding. We can completely rename Carly. Happy to rename it Nick for an organization if they're open to that. But so, one organization just renamed it Benny, shorthanded for benefits. If an organization has a very prominent and well-known leader or a mascot, we can rename Carly again to really make it feel like that it's part of their benefit ecosystem. From there, we can adjust the tone, language, and culture of Carly. And so as we think about, we can even shift the reading level, right, of Carly's responses to shift from seventh grade to third grade, anything in between or outside. And then from there, really picking up the tone of the organization. So if they're more formal versus informal, right, we can code that into Carly, and Carly will continue to kind of learn and grow throughout the partnership. If an organization calls their employees something specific, teammates, professionals, doctors, lawyers, or attorneys, that's how Carly will respond and interact with the employees. And so I say that as a first comment, Nick, because as you think about, a vertical or an industry where Carly fits in well, we've seen success in high and best in class engagement with a variety as we think about retail, tech, more of the blue collared organizations and verticals as well, because Carly is so customizable. And so I think, one, how Carly can shape shift and support any organization, again, to really make it feel like that she's part of the organization. And then I think secondly, we give a lot of credit and we focus a lot on our customer success and our account management team, right? And so as we think about post implementation into the launch and true partnership phase, our account managers, our CS team is really there to support an organization every step of the way, right? We know AI is new. And so as you're rolling out something that might be brand new for your organization, right? One of the first AI tools that either the org or your HR department specifically has adopted, we're there to help on, day zero, thinking about rolling out educational opportunities, conversations, webinars, one-pagers, very strategic and creative from a marketing perspective as we think about QR codes, at-home mailers, in on-site office support as well. And then, as from there, thinking about, real around the clock and monthly support from our CS team, that's really helped again drive that adoption within any industry, bringing that creative and strategic mind to the partnership whenever it's needed from our customers and clients.
That's helpful. How do you think about, or how do you address maybe the conversation around, hey, is this something, AI for HR organizations? Do you build this? Do you buy it? Do you find a partner that provides it? And how do you view that from your seat?
Yeah, no, it's a great question. And I think full transparency, it's a common one. And it's an important one, right? As someone's thinking about making a large investment to explore all options. And I think first and foremost, what we all on the call know today is benefits is hard, right? And complex. And so as you think about intertwining benefits and technology, the most important thing about Avante is that is our only focus, right? We are hyper-focused and concentrated on building out the best AI benefit and total reward platform. And that is our only job. And so as we think about an organization that has so many different priorities, capital, infused in so many different departments, strategies, and priorities, I think part of it's been that because of our expertise from a SaaS technology engineering background aligned with the benefits, knowledge, and experience, we've been able to really create the best in class. And organizations and ones that we even partner with today, have been upfront and said, we've tried. We didn't have enough capital. And it takes time. Right. And so again, we've been around for 2+ years, and a lot of that time was, in the lab building and creating our own platform. And so I think as an organization looks at that, fairly high mountain to climb around capital needed, the time and the expertise from both a benefit and a technical perspective, I think that's one of the main reasons that Avante's been able to drive such strong value, even in a tech forward organization, based on some of those priorities.
Yeah, and you think about the cost of maintaining and improving, and like we talked about, it's only getting better, right? So that just means there's going to be a huge need for continuous investment in these tools. Um, so I think that's all the questions that have come in, Max. Really appreciate everyone's time in joining us for this hour. Hopefully you found it insightful. As a follow-up, we will be sending a copy of the presentation and of the video. And if you want to have a further conversation with us, please feel free to reach out. Like Max mentioned, we do have preferred and specialized pricing due to our partnership with Avante. And there are creative ways that we can help you find subsidized funding for this type of technology, whether it's through carrier credits or technology credits, vendor credits. So we'd be glad to have that conversation if you're interested. And just want to again thank you everybody for your time and have a great afternoon.
Thanks, everyone. Enjoy the holiday season.